low sodium diet or low salt diet means that you take in no more than 2,000 milligrams of sodium each day. This type of diet will help your body work better if you have heart, liver, or kidney disease. Many health conditions are improved on a low sodium diet. Salt is a mineral called sodium chloride, and it occurs naturally in many foods, but only in small amounts. Most of the salt we eat comes from added salt to our foods, especially highly processed foods like soups, lunch meats, and nearly all restaurant foods. When your body has too much sodium, fluid in the body builds up. Extra fluid increases the work of your heart, your kidneys, and your liver, and it can increase blood pressure. Some health conditions like heart failure and cirrhosis are greatly affected by this extra fluid. Eating low sodium can help control these problems. This is why this diet limits the amount of sodium to 2,000 milligrams or 2 grams per day. This is about the amount and a little less than a teaspoon of salt. It isn't that much. Unfortunately, our food supply has a lot of added sodium in it, since we have so many processed foods. Foods that are naturally low in sodium include most fresh fruits, vegetables, fresh meat, and fish that is not processed. Plain grains like rice and pasta are also low in sodium. Here are 10 tips for lowering salt in your diet. First, limit highly processed foods. Most processed foods such as chips, boxed pasta, and rice side dishes with seasoning packets, canned soups, tomato sauces, lunch meat, and frozen meals have a lot of added salt. Choose fresh fruits and vegetables, low sodium whole grains, and fresh and unprocessed meats and seafood, as well as low sodium cheeses. Plan for salt across your daily meals and snacks. Plan for 3 meals and 2 snacks a day. Start with a low sodium commercial cereal or no salt added cooked cereal at breakfast. Choose low salt bread or crackers at lunch. Instead of processed meats, cook your own meat at home and use it for a sandwich. Add lettuce, tomato for flavors that are low in sodium. Use herbs and grilled vegetables with chicken for dinner. And read nutrition labels to guide your food choices. Choose sodium-free, very low sodium, or low sodium products. Buy fresh and frozen fruits instead of canned. And choose fresh foods when you can, or go for frozen without added sauces. If using canned foods, drain and rinse foods to reduce the salt. Rinsing beans, tuna, and canned vegetables before using them removes quite a bit of the salt, even if it's not all of it. Avoid canned, smoked, or processed meats, such as bacon, sausage, prepackaged lunch meats, and other products where salt is added. Eat more fruits and vegetables. Add them to salads, main dishes, side dishes, or just eat them plain. Fruits and vegetables help your body to remove water and avoid fluid buildup. They are also low calorie and naturally very low in sodium. As an added bonus, fruits and vegetables are full of nutrients that help our bodies work better. Learn to enjoy the natural taste of food. Many foods are so processed that we have to learn to get used to foods with less salt. Foods may taste bland at first, but you can use naturally sodium-free herbs and spices to add flavor to food. Create low-sodium condiments. Make your own low-salt salad dressing, dips, gravies, or sauces. Most commercial or packaged products are high in sodium, and if you choose the low salt or no salt options, you may be able to have more. Choose low salt or salt-free beverages. Save salt for the food you eat. Water, coffee, tea, carbonated seltzer water, and fruit juices have very low or no salt in them. Limit milk to 2 cups of low-fat milk a day. Avoid energy and sport drinks, commercially made milkshakes, and instant cocoa that all have added salt and can be surprisingly very high in sodium. Ask restaurants for low-salt substitutions. Ask your waitstaff or the chef how food is prepared. Choose foods made to order or low-salt preparations. Have sauce or dressings on the side where you control the amount used. Most foods in restaurants and almost all fast foods are very high in sodium. Limit how much you eat out or bring food home from these places for this reason. Check over-the-counter and non-prescription drugs and supplements for salt. Many antacids, laxatives, aspirin, and cough medications have added salt or sodium. Many mouthwashes also may have added sodium. Ask your doctor or pharmacist for help before you buy these products and check product labels. Finally, give yourself time to get used to a low-sodium diet. It may take up to 2 months for your taste buds to adjust to less salt. Over time, though, foods will start to taste normal again. For more information, including low-sodium diet menus, food lists for a low-sodium diet, and how to season food without salt, check out our patient education handouts on this topic.